We now have a new test called mass spectrometry to assess light chains and heavy chains in patients with plasma cell disorder. This test is more sensitive than your typical SPEP with immunofixation, and that has been well described in various studies that have been presented before and at the American Society of Hematology meeting. What mass spectrometry also helps us do is detect post-translational modifications like cysteine additions, glycosylation, etc. In the past, we have shown that glycosylation of light chain results in an increased risk of AL amyloidosis. Now, cold agglutinin disease is a hemolytic disease that is associated with an IgM-kappa M protein. And not all patients with IgM-kappa get cold agglutinin disease. So there has to be something about the structure of the monoclonal protein that predisposes patients to have a cold agglutinin disease. Just as there's something predisposing patients to develop amyloidosis, So we hypothesize that we might find glycosylation at an increased rate in patients with cold agglutinin disease. And that is what we found. Majority of the patients with cold agglutinin disease, which was defined by the traditional criteria, had a glycosylated light chain, and it was very unlikely to find anyone with cold agglutinin disease without a glycosylated light chain. So this just tells us that if you do mass spectrometry on a patient, the report reads there is glycosylation, and we often report that based on clinical findings, you should be suspicious of two things. One is light chain amyloidosis, and two is cold agglutinin disease, and correlate to that patient's symptoms at present and monitor for these symptoms in the future.